Welcome back to our COVID-19 discussion for our Corps members with the Los Angeles Conservation Corps. I'm Melissa Morgan with the Corps, and I have with me my colleague Adrienne, and we'll be taking you through another great conversation. Today, the topic is, what should we know today about the coronavirus? And our special guest for today's Q&A is Dr. Stephanie Koven. Hello, Dr. Koven.
Hi, thank you for having me. Pleasure to be here.
Thank you for being here. We're so excited to have another medical professional with us and to really be able to kind of circle back. There's been quite a lot of talk over the last few months, a lot of emotion, a lot of change. We've pivoted at the Corps. And now, as things are starting to transition around us, we're thinking about continued safety and health and how to work in a place and in the community in a way that we're all taking care of one another and our Corps members. So thank you for being here today. We've got a lot of questions that our Corps members have asked and some staff, and we're so glad that you're able to help us in answering some of these. So, yeah. So a little bit about you. You are friends with our CEO, Wendy Butts, and it sounds like your kids grew up together since they were little for about the last 10 years. Awesome. Very cool. Do you both have 2 kids, or?
I actually have 3 kids, so pretty busy home. So I have kids aged 10, 13, and 15, and Wendy has 2 kids who are similar in age. And so they all went to preschool together and played together and still play together. So we see each other often.
That's very cool. It's nice. We've got a wide Corps family, so welcome to it. So your specialty is general internal medicine, and you studied at UC Berkeley, went to medical school at UCLA here close by, and did your internship and now your residency at Cedars-Sinai. Tell us a little bit about how did you get interested in medicine? What was some of your journey and your path?
Yeah, so I had a little bit of a different journey, I think, than most people. I was not someone who knew I wanted to be a doctor. I went to college at Berkeley and I studied medical anthropology. So I really did not want to take any science classes or math classes. I was done with that in high school. And so it took me a while. It took me 4 years. I was about to graduate and I'm like, what am I doing with my life? And so I had to go back to school and take some science classes that I didn't really want to take, but then did well in those, and then went to med school at UCLA. So moved down from the Bay Area to Los Angeles, and I've been here ever since. I did my training after medical school at Cedars-Sinai for 3 years. And I'm an internist. So that is general adult medicine. So that's like your primary care doctor who sees patients 18 and older. So after Cedars for residency, I worked for a good long time actually at Venice Family Clinic for 7 years in Venice. And then I am now working for the last 8 years back at Cedars-Sinai in an office in Santa Monica.
Oh, wow. That's wonderful. Yeah, I've heard great things about that Venice Family Clinic. I know they do a lot of great work for the community there.
It's a wonderful clinic.
So you're in Santa Monica, and are you taking any new patients?
Yes, all the time.
Okay. Great. Because you never know. You might have a prospective patient listening in.
Sounds good.
And is this the phone number people could reach you at if they're interested in learning more about your care?
Yes, that is our office number.
Okay, so you could call Dr. Koven and her team at 310-967-8444. Wonderful. Well, as we transition and start talking about the coronavirus, I want to refer to the LA County Roadmap to Recovery. As you can see, where we are currently today, we're about in stage 2. As folks know, places of business have been opening slowly. Essential services obviously have still been working. And for Corps members, you all have been out there since day one, really working on the front line. So we know there's a lot of change happening. As you can see here, if you're watching our slideshow, you can see that the county has really worked to slow the spread of COVID-19 by following that safer at home order. here for the state of California. And so they're gradually relaxing safer at home and really working with the Department of Public Health to make sure that their decisions are based in safety and health. And core members, we want to thank you all for the ways you've really been diligent in keeping each other healthy and following all of the new guidelines that we've had. We know it's been a lot, and you're already doing a lot of work and already have a lot of high expectations to fulfill. So thank you, core members, for everything you've done and for all of my colleagues to really be able to continue to support the core and the good work we're doing to keep the community really clean, green, and healthy. So if folks want to learn more about what's going on with the coronavirus, COVID-19, you can visit the LA County website, which is covid19.lacounty.gov/recovery, which is now we've moved into the recovery phase. All right. Just a quick disclaimer. The LA Corps, we're not a medical organization, and our staff are not doctors or public health officials. I'm a marketing manager. So this interview is really being conducted for the purpose of distributing information to our staff and our core members, and nothing shared in this podcast should be construed as, nor is it intended to be used for, medical diagnosis or treatment. So, of course, should you have any healthcare related questions, including any of those about COVID-19, please do seek medical assistance. So we'll be including some resource links and information at the end here. And really, this is just a chance for us to have a conversation around some of the questions that you all have. And so, Dr. Koven, I'm going to ask you a series of questions and would love to get your insight. So here's one of our first questions. How important is it to keep practicing safety guidelines? For example, how long will we have to continue to do that? And do you recommend any other practices? You know, when we look at social distancing, wearing face masks, using hand sanitizer, sanitizing our tools and vehicles, how important is that today? And where do you think we're going?
So those are all really good questions. And it's sort of addressing the idea of what are we doing now and how long do we have to do it? So kind of what are we in for in the next months to come? So, going through all of those social distancing and wearing face masks, I think those are the two that stand out to me. So I like to call it physical distancing because I don't really want to be socially distanced from people, but physical distancing, that 6 foot away from the person next to you really is crucial. And if we kind of delve into the reasons for that. So coronavirus is primarily passed through what are called respiratory droplets. So that's coughing, sneezing, talking loudly, laughing, anything sort of wet that's coming from your mouth, whether you can see it or not, goes into the air, and really it can't go more than about 6 feet. So you really want to sort of, be away from a person. You don't want to be close to them. And you really want to, even if you're in a group, you want to maintain that distance. The next thing you can do, which is crucial, is the face masks. So, those don't need to be N95. Those don't need to be surgical masks. They can be cloth masks that you get online or have at home. And, as long as you're washing them regularly and they're staying clean, and the fabric isn't breaking down, those are very protective. So I think people get a little confused about what they are protecting. They're basically, if I wear a face mask, I'm protecting you from me. So my spit is not going in towards you. So basically, everybody who's wearing a face mask is being very sort of respectful of other people and understanding that they don't want to get other people sick. So the next issue is washing your hands, hand sanitizer. Hand sanitizer is great. You want to use hand sanitizer that's more than 60% alcohol. And you want to use it all over your hands, rub thoroughly between your fingers, between your thumb and your pointer finger, but really washing hands, like soap and water, you can't really get better than that. Like soap and water, 20 seconds is really crucial. So even if you don't have hand sanitizer everywhere, you don't have to worry about that. Just really washing your hands is perfectly good, and doing that frequently especially if you're out working, or you've been in a car or in a grocery store. You want to sort of do that frequently so that you're staying as clean as possible. And then sanitizing tools and vehicles. It's like any workplace, really. We do the same in our offices in the medical field. After every patient, we are sanitizing that room to make it ready for use for the next person. So the same with tools and vehicles. So if I'm sitting in a seat in a car or a bus, I want to protect the next person who is going to be sitting down there. So that seat needs to be cleaned and disinfected and ready for the next use. And the same with tools. As far as, getting into how long are we going to have to continue to do so, I think that's the big question, right? So I don't really have an answer to that. My guess is that at least for the next few months, there's lots of research being done as far as how this is going to, finish. It will be over soon. I know it's hard to believe, but it will be over. At some point we will have a vaccine that might not be until 2021. At some point, enough people will have gotten the virus that we will have what's called herd immunity, which is protective for a whole community. I think we should be prepared mentally and physically to, be wearing our masks and distance from one another for at least the next, few months.
Wow, that's a lot. Thank you so much. So I have a couple questions. Is it true? I've heard this myth that after a while, hand sanitizer doesn't work, or that we build an immunity. Is that true, or is that a myth?
I think that's a myth. I have never heard that. I use hand sanitizer all the time, and I have full confidence that it is working. But like I said, soap and water is just as good, if not better.
Mm-hmm. And would you say, would it be good practice for our core members? We have split up how they're dispersed in their crews to go out in the community to work, and so there's less people in each truck or van or car. Would you recommend that they sit back in that same seat when they're going from place to place, since you're saying how important it is to keep our spaces clean of germs?
Yeah, I mean, if you are taking a van or a truck out to a site, and say one person is sitting in that front seat, probably a good idea, unless you can disinfect that seat before the next person sits in it. It might be a good idea to have sort of assigned seating. Okay. We have that in our workplace, and again, even though I'm in a medical office, we're very strict about things, but I think it's a good sort of lesson for every workplace. Like, we have assigned seating. I sit at a certain desk and I stay there all day. And unless I'm going to see patients, they sanitize after I sit in that chair that I'm with my patients. So same thing, whether you're, in a truck or a vehicle or wherever.
Yeah. Okay. You mentioned a term that sounds pretty interesting to me. Herd immunity. Is that like a herd of cattle or sheep?
I know it sounds like it, right? But no, it's basically the idea that, the numbers that I've heard for this are, and for any type of infection, or if you can get, about 60% plus of the community, say, of LA County, having testing positive, meaning they've had the infection, that protects the people around you, so that you are not then passing it back and forth. Most people at that point will hopefully be immune. So you don't, right now, I think our status of our immunity is probably more around like 5 to 10%. So we're not there yet. But that is the goal, to, not for people to get sick, obviously, but for people to recover from the virus and, be immune, hopefully, and then protect the people around them.
Okay. Well, thank you for that. Just want to give a shout out to all of our partners who've donated masks. That has been incredibly helpful for the Corps. We've had board members, local businesses, some new business friends that we've met who've been donating masks over the past few weeks. So just wanted to say thank you to all of those, even some folks who've been hand making them for us. So that's been really great. All right, moving on to our next question. Are there any businesses that you recommend that we avoid? So, is it safe also to go to work, to church, places of worship, gyms, restaurants, maybe even with some of the outside seating? And how safe are public restrooms in these places? What should we know?
Yeah, so I think that's a good question. I think that's on all of our minds as LA County in particular sort of slowly and safely opens up more businesses. We're seeing more restaurants opening, potentially movie theaters, potentially maybe gyms will be opening soon. I don't think that they're open right now. I don't think that there's any businesses that I would avoid. But what I sort of go by is, am I going to feel safe there? And so the things that I look for when I go into a business or a grocery store or a restaurant are people wearing masks, and are people maintaining their physical distance. So 6 feet again is what I am looking for. And you don't want to see people crowded into a small space. And for a restaurant, for instance, you want to see that maybe they have staggered the seatings of people. They're maybe accommodating less people at one time. There's outdoor seating. We live in LA. It's beautiful weather. We can all sit outside. So really, like, ventilation is also wonderful, because then you're not, again, like getting those respiratory droplets. It gets a little bit more difficult in places like gyms. Gyms are not open yet. That's a challenge, I think. A lot of people are really upset that they can't work out, and everybody's sort of headed to the streets to bike and walk and run. I think that's great, but there's sort of nothing like going to the gym for some people. So, I think gyms you need to look, if you want to go back to your gym and they're open, for, are they maybe limiting the number of people at any given time? Are you visually seeing people disinfecting the equipment? Are people wearing masks? All of that. So, you really want to be your own advocate and understand where you are going in the community and feel safe. As far as public restrooms, sometimes it might be inevitable to be in a public restroom. I mean, it's the same situation, really. You want to not touch that many things, but it's inevitable that you have to touch things. So you want to wash your hands after using the restroom, as usual. And again, use that 20 seconds for hand washing. If they have hand sanitizer as well, you can use that. And you don't want to be touching too many things. But again, I think most guidance right now is that this virus is passed mostly through person to person. So respiratory droplets. So if I'm coughing and sneezing in front of you and I don't have a mask on, I'm putting you at risk. So though definitely there is some evidence that you can get it by, say, touching a surface that has not been cleaned, but it's less so. I think more the risk is the people around you.
Okay. Yeah. Yeah. I've heard definitely that I think one of the larger institutions was saying that the germs don't stay on hard surfaces anymore. So that's so confusing. So it sounds like you're saying definitely just keep cleaning and sanitizing. And that's like the best way that we can keep our spaces as healthy as possible.
Yeah, I mean, I think that there's a lot of information out there, and it's hard to really kind of piece out which is correct. As far as how often should I be sanitizing? Do I need to sanitize all my groceries after I come back from the grocery store? I think the most important thing is just really be conscious of sort of where your body is in space, and that you're not touching too many things. But we live in a world where you have to touch something. So it's hard. I think everybody is missing kind of giving each other hugs and that physical contact. Like at churches, that's a hard one too. Everybody wants to go to church, and that's hard to do when you are limiting the number of people and not having that intimate contact with people.
Right. Yeah. It makes me think of just some of the neat things I've seen in my neighborhood where people are having like drive-through birthday celebrations and graduation celebrations right now. I've loved seeing how people have found creative ways to still connect and still celebrate. That's been really touching.
Yeah, it's been really nice to see all these creative, I agree, graduations and even, places of worship. So I think people are getting creative and kind of making it work for themselves in a safe way.
Yeah. Okay, our next question, Dr. Koven. Do restaurants have any laws or regulations you know of that will help to keep patrons safe? What do you know about that?
So yes is the short answer. So really, restaurants in any business, this again, same with my office, like we need to follow strict guidelines from LA Department of Public Health. So that's LA County's Department of Public Health that really is guiding us in LA County for how do we safely reopen? How do we keep everybody safe in our offices? And, if I'm an owner of a restaurant, how can I legally open my office and, serve food, or, a barbershop, how can I cut hair, etc. So yes, they need to follow strict guidelines. The two sort of resources that I look to and that most businesses are looking to are Center for Disease Control, which is just a national agency giving lots of guidance for all infectious processes, but in particular coronavirus. And then for us in LA County Department of Public Health.
Okay, thank you. And we'll share some of those links at the end of our conversation so folks can check them out. All right, moving on to our next question. So at the core, we have an after-school program and a huge team of folks who work with middle schools and elementary schools doing the after-school care, which obviously has been on hold because of self-quarantining and the pandemic. But some of our colleagues were wondering, once we start getting back into that after-school care, should staff who work with school-age children be tested before interacting with them?
So I think that question is probably asking, there's two COVID tests. So there is one, which is probably what you've heard about, which is the nasal or the oral swab. And that tells you, do I have COVID right now? Am I sick right now with it? And then the other test is a blood test, which is an antibody test, which tells me if I get that test today, if it's positive, it doesn't show that I maybe had it a few weeks ago. So I think that question is getting to the idea of, should I be tested? Am I sick currently, or am I, potentially even immune to it? And am I maybe safe to see, be with kids in that environment? Right now the guidance is not to do that testing. There's no guidance, there's no law to test anybody before they go back to work, whether that's teachers or doctors or any business. So again, that's guidance right now. So what we do and what I think is good practice in our office, and this might be a good idea for school-age children. Again, everybody has to sort of figure out what is correct for them. And feel safe, is we do temperature screenings for everybody who walks in our door. So we do temperature screenings, and if you have a fever above 100 degrees, then you're basically not allowed to come in until that fever is gone, or we ask you a few more questions and make sure you're not sick, or if maybe you just bike to work and you're hot because you bike to work, that fever has to come down. So you are not allowed entry until you are known to not be sick. So that really limits the amount of potential exposure to coronavirus for everybody. And then, obviously we all need to be really upfront with ourselves. And if we're not feeling well, whether that's a fever or a cough or a sore throat, or feeling a little fatigued or chills, muscle aches, like you really should stay home from work. So whatever work that is, you don't want to get yourself feeling worse and you don't want to expose other people. But as far as testing, again, I wouldn't advise that right now. We aren't doing that in the medical community, and I don't think that that's a good idea right now for schools.
Have you, I'm curious, have you come across any patients, knowing that there's confidentiality, but have you come across folks who've had coronavirus in your practice?
Yeah.
And
Yes, definitely. I think all of us in the group that I work with, we've all had either a handful or more of patients who have been sick with coronavirus. So again, most people will have some symptoms with coronavirus. I think the statistics are that 80% of people who have coronavirus will have a very mild course, so kind of like a flu, and not need to go to an emergency room, not need to go to an urgent care, not need to be hospitalized. The 20% is, the ones who get more sick and need to maybe be in the hospital or the emergency room. But, most of the people that I have seen and had patients have done very well. It's an ongoing process, and we've seen a slow of the spread of it in LA County because we've done a lot of great work with all these safety measures. So I think we just need to continue to do that to flatten the curve and really protect ourselves and to maintain all of our personal protective equipment and stay safe.
and for folks who think maybe they're coming down with it, is the best practice still to go ahead and call their healthcare provider, not show up somewhere?
Yeah, definitely don't show up somewhere, because, again, you don't want to expose other people needlessly. So if you are feeling sick and you are worried about it, you think maybe you've been exposed or you don't even know if you've been exposed. If you have any inkling that this might be what's going on, you need to call your doctor and have that conversation with the doctor. So right now in June and even back in May, like COVID testing is widely available. I know that in March and April it was not, but I can't speak for all health systems, but I know LA County is doing a lot of testing every day. We at Cedars are doing a lot of testing. Like, if you need to be tested, you can be tested. Please do not go to work. But that's the point at which you really want to quarantine yourself. And not expose anybody at work, not expose anybody outside. And really, it's hard when you live with other people, but really try to minimize exposure to even the people you live with at home. So if you can stay, in your own bedroom, if you have more than one bathroom, maybe use your own bathroom and really, try to protect the people around you.
This is great information and really great reminders. It feels like it's been a year since all of this started. It feels like it's been really quite a long time. So I'm hoping that this is helpful for folks listening. I know it's helping me remember a couple pointers because it's all sounded so scary. So it's nice to know, and think through, what would I do if that was me? Okay, so this is one of our last questions, and then we've got some tips to go over. So Dr. Koven, if we get sick and suspect that we have COVID-19, what can we do to prevent the spreading of it to other people, particularly if we do need to visit the hospital or doctor's office? Are they doing anything special when you show up to the hospital or to a doctor's office so that they're keeping folks, keeping germs quarantined from others who may not have them? How's that working?
Yeah, so I think like I said before in the last question, so, it's hard to prevent the spread to others that you live with. But, you can do your best by, again, disinfecting, cleaning, wearing a mask, sort of isolating in your own part of your apartment or house, using a separate bathroom. If you needed to go to a doctor's office or urgent care or even an ER, you're going to wear your mask, obviously. We have at Cedars, and I'm sure, all hospital and urgent care facilities developed safety protocols that, for instance, in our urgent care, we've set, if you have a fever when you walk in the door with that temperature screening, if you have symptoms, you go to an area of the urgent care that is for people with respiratory symptoms and fevers. So that is where we are using our full personal protective equipment. So we are putting you as the patient in a room very quickly. So we're isolating you from other people, so you're not exposing other patients, other staff, other doctors. And then when we're seeing you, we are wearing a gown, we're wearing a face mask, a glove. We're all dressed up. You can barely see us, just our eyes and gloves. And then we're really, minimizing the amount of time that we are spending in the room with you, not because we don't want to talk to you, but so that we're protecting ourselves and our staff as well. But yeah, we have very strict protocols in place, and that has been what we've been doing for the last, say, 2 to 3 months while this has been happening. And we really feel very safe and secure in that, and patients should feel that way too.
Do you have any tips for core members? I'm thinking, just how seriously in the medical field, the precautions are. And for core members, they're going to work together, taking lunch breaks, working in their crew, riding back home, ready, to end the day and go back, maybe to their families, or maybe some of them have a second job. And it can get pretty comfortable feeling. I've even noticed, and when I've gone and maybe interviewed some core members, just I start to feel like the old times of wanting to maybe get close and talk close, or wanting to hug somebody, or wanting to get closer to hear what they're saying to me through the mask. Do you have any tips for why, and pointers really, how and why it's so important for us still today to take all these safety precautions when we're at work?
So I think the safety precautions at work, I would say that most people I know, and maybe this is changing a little bit more as more beaches and parks kind of open up, most people are staying home unless they need to go to work, right? So where we're seeing a lot of other people is at work. So that is potentially the place that you're putting yourself at risk. So that's why, you have to really wear the mask at work. It might feel like, oh, I don't want to wear this mask anymore. It's bothering my face. It's itching my nose. I feel the same way, but I still do it because I want to protect the people around me, and I want to be protected. So, it takes a certain vigilance and sort of not to drop your guard. I think that people should feel safe going to work. And as long as those safety protocols are in place, work is a very safe place to be. As long as you are working in a place like the Corps that is really taking it seriously and protecting the people who work there.
Yeah, so it really sounds like it's, I'm just thinking about our core members, how I really look to them as leaders of the present and the future. And so it sounds like the job is really, it has a lot of responsibility. And this is some of leadership to, being responsible for our own personal health as well as others. I think the coronavirus makes us think about that, how much we can impact other people. So thank you. Thank you for that insight. So let's look at a couple of these tips that we've got just to remind folks of some ways to stay healthy and how to, just protect ourselves right now. So we've still got those physical distancing requirements, and are encouraging people to wash their hands. How many seconds is that, doctor? We're supposed to wash our hands?
That would be 20 seconds.
Okay, so wash your hands. Remember to do that thoroughly. There's some cool videos online I've seen of people putting black paint on their hands and then just showing just all the work it takes to get it all over your hand. Just thinking of soap and water, just, being very intentional of getting into all those cracks and crevices. Wearing face coverings when we're outside and around people who don't live in your household. Remember to follow quarantine and isolation orders, regardless of whether you're tested or whether you've tested negative. To continue to avoid large gatherings of people outside of your household. Still really important to do, as we've heard. Pay attention to guidelines that are posted at businesses if you must visit them. And we've been keeping core members and staff up to date with visuals and signs and posters on all of our doors. And if folks need some information on testing, you can visit COVID-19 lacounty.gov/testing. There you can find information about testing that's in your local area. So just a couple tips to remind folks here. And as we begin to close out, do want to remind people that our mental health is really important. There's been a lot that's been going on in the community with the uprisings, the unrest, conflict in our communities. Plus, we're quarantined at home. It's a lot of stress, a lot of pressure on all of us. So we just want to remind folks, if you or someone that you care about is feeling overwhelmed with emotions like sadness, depression, or anxiety, or if you feel like you might want to harm yourself or others, definitely call one of these lines, one of these disaster distress helplines. You could call 1-800-985-5990. That's 1-800-985-5990. Or you can text the word with no spaces, talk with us. That's talk with us. Text that to the number 66746. So again, text talk with us with no spaces to the number 66746. And you can receive some text message support. And also, it's really important for us to be aware of domestic violence during this time with all this heightened stress and anxiety. So we want to offer to everyone the National Domestic Violence Hotline. It's great to just save to your phone if you ever have a friend in a situation or find yourself in a situation and you don't know what to do. You can call the National Domestic Violence Hotline at 1-800-799-7233. That's 1-800-799-7233. And of course, remember to call 911 in an emergency. So some helpful links. I heard Dr. Koven speak about this. We've got the Center for Disease Control. Check out cdc.gov/coronavirus. Or here in LA County, again, you can look up publichealth.lacounty.gov. And if you'd like to find out a little bit more about how LA is dealing with the coronavirus, you can go to corona-virus.la. And lastly, the World Health Organization, if you want to know what's happening globally, check out who.int. So there's just a couple of websites. If you're listening to us on the podcast, you can check us out on our YouTube channel. You can get there from our website. Our website is www.lacor.org. That's LACORPS.org. And core members, if you don't know, we have a huge resource guide of resources to help our families and our core members and our community and our neighbors out during this time. So a lot of great resources, and we have them divided up geographically. So check that out. It's a really nice PDF document you can check out online. That's at lacor.org/resources. lacor.org/resources. And with that, folks, we want to thank you, Dr. Koven. Thank you for joining us. Thanks for being part of this conversation and helping to keep us healthy. Do you have any prediction for the future? How do we get through this stressful time? What's something that keeps you going? What helps you get through this?
Well, first of all, thank you for having me. It's been a pleasure. I think we just all need to take it day by day. I think those resources for mental health are super important. I think anxiety and depression are sort of rearing their ugly heads in all of us. And we really need to focus on self-care and the care of our families and our loved ones. And you got to take time for yourself. I like going on runs. I like going outside, walking my dog, taking walks, and just breathing the fresh air. So you just have to make time for it.
Absolutely. They say that the core is like a family. And so I'm hoping that core members really do reach out to your core member development team, your core navigators. We're all at the core because we care about our youth, we care about our future, we care about our community. So thank you for joining our family, Dr. Koven. Thank you, Adrienne, for your help today. And thank you, core members and colleagues, for all the great work you do to keep our community clean and green.